Dr. Diez, you mentioned in another video that you sometimes refer a person to a chiropractor when a person comes in with headaches, even though you do your job in the DMJ, meaning the hinges of the joint chast, whatever you call that stuff, and basically realign the teeth the way they're supposed to be, because that's a big cost. But quite often, chiropractor is needed. Are there any other specialties out there which are quite often needed, especially to solve the problem of headache, shoulder pain, and neck pain and back pain, because those are very heavy problems, and many people don't think they should go to a dentist for it at all, and yet you enlist the help of other people also to work in synergy.
Yeah. Again, we play a critical role in the appliances we make to assist the patient in overcoming these problems. But, you know, a lot of times the patients are coming to us, like you were talking about, with all kind of misalignments, because there's been years of problems, and the muscles are tense, and there's muscle imbalances. Chiropractors help us out tremendously, and physical therapists can help us out tremendously. And many times when I send a patient to the chiropractor, they'll find other problems that have been contributing to the problem they were treating. Same with physical therapist. And for instance, if they see there's a discrepancy with the length of one leg, and it doesn't take much to throw the whole body off, then a lot of times they'll send our patients to a podiatrist. And it takes many times a team of healthcare providers that have a specialty in certain areas to put the whole picture together and really solve the patient's problem. And that's why I really, really believe in getting assistance from, again, chiropractors and physical therapists. And a lot of times then the patient is directed to another healthcare provider.
Such as a podiatrist.
Treating the problem. Like a podiatrist.
Well, I can see it, because after all, you stand on your feet all day long, so you have 150, 180, whatever pounds daily on it. And for instance, like I remember my father, he, as long as I knew him, he had a bunion. And so right there, people with a bunion, it hurts, they tend to walk crooked. And next thing you know is it goes up the spine, a chiropractor is needed, and it might even move your teeth around, or the teeth, are already out of alignment also, so it's kind of like an addition to it, and it comes from both ends, and you wonder why the person has major back pain and major headaches.
Yeah, like you say, it's coming from both ends. Walk around with one shoe on and one shoe off all day long. You're going to be sore. And a lot of people, in effect, are doing that because things, like you said, what you're standing on is not in harmony, is not balanced. And podiatrists can solve that problem pretty easily.
So basically, fix the top, fix the mouth from where lots of stuff emanates, fix the bottom, the feet where lots of stuff emanates, and of course align everything in between with chiropractor, physical therapist, and you might just have a healthy body again.
Yeah, everything needs to be in balance, and that's what these other doctors do. It's great.
Beautiful. Thank you very much, Dr. Diez.